An area of aging that a lot of people don't talk about is the midface. The midface is the area basically under the eyes but above the mouth, and this little cheek area here. We're seeing a lot of stars nowadays with these super puffy cheeks where they'll get vials and vials of injectables placed into their cheeks, and this is an option. But in my opinion, the midface, the aging of the midface has to do with three things. You get loss of fat in the area, so you have a loss of volume. You have sagging of some muscles and skin, so you get a sagging sort of look to it as well, and you get skin changes associated with this area. Your lower eyelid is also in your midface, and it's an area you really need to take into account as well. In my practice, I've gone from strictly surgical management of this problem to a combination of injectables and surgery. The lower eyelid, we talked about lower eyelid surgery, and it's a great option to rejuvenate the lower eyelids, to get rid of the bags of the lower eyelids, to get rid of the tear trough of the lower eyelids. But then there's the volume issue. The volume issue can be handled one of two ways. An easy way in the office is with injectables. In my practice, I use Restylane in this area. I think this can give a great result to the lower eyelids and to the cheeks. Injectables only does not deal with the sagging component of midfacial aging though, and in some patients I'll recommend a midface lift. What a midface lift is a surgical procedure. I do this using a combination of cameras and endoscopes through an incision in your temple. Sometimes we do place an incision inside your mouth as well, but basically we lift these tissues that are sagging in your midfacial area and pick those up to back and put them back to where they need to be. We use a combination of different suspension techniques to do this, and we'll talk about the right ones for you in your consultation with us in the office. But take-home message is that midfacial aging, I think, is a huge component of your overall general appearance, and there are things we can do in the office and surgical procedures that can help with this area.